Hello, doctors. I am Dr. Nahid from Bangladesh. I passed MRCS Part A exam in September 2021 and I scored 90%, that is 270 out of 300. Since then, I have helped a lot of doctors here in Bangladesh to pass MRCS Part A, and I have been keenly following the exam patterns for the last 4 years. So here, I am going to give you some tips regarding what you can do so that you can pass MRCS Part A exam in a single attempt. So it is a thorough guide by me. So you all know MRCS is a diploma equivalent exam awarded by Royal College of Surgeons, and it has two parts, that is Part A and Part B. Part A is single best answer. There will be around 300 questions and you have to select the best answer. And Part B is MRCS OSCE exam. That is, you have to give the exam in a center and you have to do certain things. In case of Part A exam, there is actually 3 exams that is being held per year. That is in January, May and September exam. And Part A exam consists of 2 papers. Paper 1 is on applied basic science. Here, questions will be asked from anatomy, physiology, pathology, etc. And paper 2, here questions will be asked from principle of surgery, that is perioperative care, common clinical condition of surgery, etc. So what is the mark distribution? The total mark is 300 and the total time is 300 minutes. In paper 1, there will be 180 questions and there will be 3 hours. So you will get roughly 1 minute for each questions. After that, there will be an 1 hour break. And then again, you have to sit for the exam and there will be 120 questions in paper 2 and you will get another 2 hours. So there will be 1 minute for each questions and the questions are quite lengthy. So you have to be quick. And what is the pass mark? The pass mark varies depending on the difficulty level of the question. In my session, the pass mark was 210. But in last January 2024 exam, the pass mark was only 189 because the questions were much harder. So the mark distribution or the pass mark increases or decreases depending on the level of the hardness of the exam. So in paper 1, from anatomy 75 question comes. So out of 375 question is from anatomy. So you can surely appreciate that 25% of your total question is from anatomy. So you have to master anatomy. Among the topics, most of the questions come from abdomen, superior extremity or inferior extremity. Recently, a lot of questions are also being asked from head and neck. So you can't leave any topic unattended. You have to understand the every topic of anatomy. You have to know the every topic of anatomy very well. From physiology, there will be 45 marks and the topics are usually much less than anatomy and usually people do very well in physiology. In case of pathology, there will be 37 marks and from pharmacology, there will be only 8 marks. From pharmacology, usually we don't need much information. For practicing surgery, whatever we need, we have to know about them. For example, while doing surgery, we need to anesthetize the patient. So we have to know about the anesthetic drugs. We have to know about the antibiotics. We have to know about the analgesics. We have to know about the anti-thrombolytic and antiplatelet drugs. That's all. So pharmacology only 8 marks. From microbiology only 7 marks. So you don't need to read everything about microbiology from textbook. From imaging, there will be roughly around 5 questions. What type of imaging comes? Usually there will be some X-rays, there will be some ECG, etc. And there might be some pictures also of endoscopic pictures also. But one thing is, not always 5 questions come from imaging. For example, when I gave my exam, there was only 1 X-ray. So imaging, not always there will be 5 questions. And from data interpretation and audit, that is usually from biostatistics, there will be 2 to 3 questions. So that's all from paper 1. You can definitely understand that 157, that is anatomy, physiology and pathology, out of 180 is the main bulk of questions. So you have to have a very good preparation on anatomy, physiology and pathology. In case of paper 2, 45 questions come from common surgical conditions. You can see there are a lot of systems in our body. We have cardiovascular system, we have respiratory system, we have gastrointestinal tract, we have colorectal tract, we have breast, endocrine glands. So there are a lot of topics and there are a lot of common surgical conditions, but the marks are not much, only 45. So you have to be very selective while taking preparation from common surgical condition. But if you see from perioperative management, this is a very concise topic. Here, 35 questions come from perioperative management. Again, assessment and management of patient with trauma, around 30 questions come. So what are the questions that come from perioperative management and assessment and management of patient? You can see on my right-hand panel in color pink, assessment and management of patient with trauma. The 30 questions come from general questions, that is ABCD management, from shock, from wound and soft tissue injury, from burns, fracture, dislocation, and organ-specific trauma. For example, there will be some questions from splenic injury. So the topics are not very vast, but 30 questions come from here. Another very concise topic, but many questions come from is perioperative management. You can see very selective topic here, but 35 questions come. So out of 120, 65 questions come from a concise topic, and that is where you need to put all your attention. You have to have a very good preparation in perioperative management and trauma part. And from common congenital and acquired surgical condition, you can see a lot of system, but a very little question. You have to read, but you can't spend a lot of time reading all these topics. You only have to know the basics, and you only have to know what is needed in the exam, not much. Again, pediatric surgery, that is surgical care of children, there will be 7 questions, and there will be 3 questions from medical legal aspect of surgical practice. So again, I'm going to make this clear. They always don't religiously follow this mark distribution. There will be some variations here, but roughly this is the mark distribution. So what are the resources? I will say still, if you want to pass, I'm not talking about 270, 280 marks. I'm talking about 195, 200, 210 marks. Then you only need 3 resources, that is MRCS question bank and its all explanation, recall, and Fauci's sheet. So let us move on to them one by one. What is MRCS? MRCS is a question bank of 2,200 questions, and all the questions have an explanation. So you might get feared that there will be 2,200 explanation, but the thing is not like that. Many explanations are being repeated. That is why for 2,200 questions, there will be around roughly 1,200 explanations. And these explanations are the core knowledge for MRCS Part A exam. You have to understand and you have to know every explanation very well. And with this core information, you can definitely pass the exam. And what is recalls? Recalls are nothing but the previous year's exam. The examinees usually come out and jot down all the questions that came in their exam. That is, they reproduce the exam from their memory. That is why it is called recall. You have to solve recalls. Last 3 to 5 years recall is a must. You must solve recall. And again, there is Fauci's sheet, which is a compilation of 313 questions. But from these 313 questions, around 10 to 15 questions come to the main MRCS Part A exam every session. So you also have to know about the Fauci's sheet. So MRCS question bank, recalls, and Fauci's sheet, these 3 are your core resources. Then what is Reda Harvey notes? Reda Harvey notes are nothing but compilation of all the explanation of EMRCS question minus the questions. So in EMRCS question bank, you will get all the explanation plus question. In Reda Harvey notes, you will get all the explanation reannounced, but there will be no question. So you can take help of Reda Harvey note. How? What you can do is, for say you want to study abdomen of anatomy. So you will open Reda Harvey notes. You will go to abdomen section. You will at first read all the explanations, all the information of abdomen from Reda Harvey notes, and you will open the EMRCS question bank and solve the abdomen questions. In that way, you can save a lot of time, and you can fasten your preparation time. You can make faster preparation. So what is RAFTERY? RAFTERY is another book that is on applied basic science. Earlier, I wouldn't have mentioned RAFTERY for taking preparation, but for 2 to 3 sessions, I have seen that there are some questions that come directly from RAFTERY. That is why you have to know about the RAFTERY. How you can use RAFTERY? You have to at first read the topic from EMRCS question bank first. Say you want to read physiology. So you will read physiology theory first from EMRCS, then you will solve all the question of EMRCS. And after that, you will open the Raftery book. You will see there will be hardly 2 to 3% additional information. You will mark them and you will learn them. That is how you use Raftery. You have to spend very little time on Raftery. What about past test? You know, past test is a very big question bank. Another very big question bank. You don't need to solve past test to pass MRCS Part A. This is what you need to know. You can write this down boldly. If you really want to do some past test, then you can read trauma and perioperative part from past test. As you have seen, trauma and perioperative part carries 165 marks out of 120. So if you really want to read past test, you just read trauma and perioperative part from past test. Bayesian lab. What about Bayesian lab? About Bayesian lab is there will be some topic while you are solving recall or reading EMRCS that you don't know in your undergraduate level. For example, I haven't heard of motor neuroma in my undergrad level, but whenever I knew about motor neuroma while solving recall, I just checked that from Bayesian lab. In that way, I have a short, concise knowledge about that topic. So if you really need to check Bayesian lab, only check those topics that you don't understand at all. Otherwise, you just can't check every topic from Bayesian lab. In that way, your preparation time will be very long and it will be very difficult to memorize also. So Bayesian lab, only when you don't understand any topic, check that topic from Bayesian lab. Otherwise, no need. Netter Atlas. Atlas, you know, is a book of pictures and it is very good for taking preparation for anatomy. As you know, 25%, that is 75 marks out of 300 is from anatomy. You definitely need to have a solid knowledge of anatomy. And without seeing the pictures, without knowing the pictures, you can't expect to have a very solid knowledge of anatomy. So any atlas will do, but Netter Atlas is a very good atlas for anatomy. And you can also take help from your own undergrad books. And another very important thing that I haven't written here, that is NICE guideline. You know, the British doctors follow NICE guideline for every disease. Like there is NICE guideline on thyroid disease, there is NICE guideline on breast disease. From these guidelines, there will be some questions. There is actually some questions that come every year from NICE guidelines. You definitely have to know them. And you can always search on internet writing NICE guideline on thromboprophylaxis, and you will see. And these things, NICE guideline will help you taking a very good preparation for MRCS Part A. If you are in Bangladesh, you can definitely take our book. We have written a book, we have compiled a book that is Notes on MRCS Part A Complete Solution. What we have added here is we have added all the explanation of EMRCS question bank. We have added all the question of latest 2024 EMRCS question, and we have sorted it out, which is most important. You see, when you open your EMRCS question bank, you will see, for say you are trying to read anatomy, you are trying to solve anatomy question bank, you will get number 1 question from abdomen, you will get number 2 question from superior extremity, you will get number 3 question from inferior extremity. That is very haphazard and it will be very difficult to take a good preparation. So what it did, we sorted all the questions according to systems. So whenever you open our book, you will have an index first, then you will see, for say you are reading anatomy, you will at first read abdomen. We have added a lot of Netter Atlas pictures and other relevant pictures so that you don't have to open any other picture book. Then after reading theory, we have sorted out the questions. You will get exclusive questions from abdomen only. So you will get EMRCS question on abdomen. After that, you will see theory from superior extremity with all the pictures. Then you will get only question from superior extremity. That way, we have improved this book. And again, we have added all the necessary informations from Raftery. We have added necessary information from Bayesian lab. And we also have added all the important NICE guidelines here. So it is a complete book. If you can collect this book, you can collect, and you only need recalls and Faugia. Otherwise, you don't have to collect any other book. If you don't have access to our book, then you can always use Reda Harvey to read the theories. So subject-wise anatomy, for anatomy, you have to know all the explanation of EMRCS and check Netter Atlas a lot or any atlas that you have, and also check Raftery. For physiology, EMRCS topic are enough, but you have to have a very clear concept of all the topic of EMRCS. For that reason, you have to do what you need to do. You can take help of YouTube, you can take help of your colleagues, You can always search ABG analysis and you can have a clear concept. So this is very important to have a clear concept. For pathology, EMRCS topics are enough. For common surgical condition, EMRCS topics are enough. And as I have already mentioned, you can check some topics from Bailey and Love only if you don't understand. Otherwise, you don't need to check every topic. For perioperative care and trauma, you can check EMRCS plus past test, both, because from these two topics, these are not very large topic, but 65 out of 120 questions come from here in paper 2. So these two are of paramount importance. And all other topic, you only need to know about EMRCS question banks topics, nothing else. So how you can take preparation? Say you want to sit for the exam. I would say you should start with physiology. Why physiology? Because physiology is much easier. It would take hardly 5 to 7 days to take preparation for physiology. And after finishing physiology, you will have a great confidence booster because physiology carries 45 marks. So whenever you have finished reading physiology, which is very easy to read, and you will feel like I have just started reading and I have already finished 45 marks. So that is a great confidence booster for any doctors who are trying to studying after a long study gap. So I would suggest you start with physiology. After that, definitely go to anatomy because it carries 75 marks. And take your time. Anatomy is the most important part of your preparation. After that, you can read clinical microbiology. As you can see, I have mentioned pathology last. Why? Because when you are taking preparation for principle of surgery's common surgical condition, while reading common surgical condition, you will cover 80% of pathology. So you don't need to waste your time by reading pathology first. You can read pathology at last. So after clinical microbiology, the most important topic of paper 2 should be addressed, that is emergency medicine and trauma, perioperative care and legal issue, and critical care, etc. After that, you will read principle of surgery, that is region-wise, that is common surgical conditions. And lastly, you will read pathology. Why? I have already mentioned. After reading principle of surgery region-wise, you will have almost 80% of pathology covered. So that is what you should do. This is a very important and very nice algorithm that you can follow for yourself. So what should be the strategy? First, read Reda Harvey notes, or if you can manage our notes on MRCS Part A quickly, then solve the question. Say you are reading abdomen. First, go through all the theory of abdomen, then solve EMRCS question on abdomen. Say there is 200 question on abdomen. After reading the theory, you will get right answer of around 150 questions. Mark the other 50 questions that you did wrong. When you will read second time the explanations, when you revise the explanation second time, you will only check those wrong questions. In that way, you can save a lot of time. So what should be the time, ideal time that you need to pass the exam? It actually depends on your level of understanding in the level of basics you have in your undergrad level. If you have a very good basics, then it is 3 to 4 months is enough. But if you have a long study gap or you don't have a very good basic, then you can take a time. I suggest you take time. Why? Because it is a very costly exam and you should take some time to have a very good preparation. So the first reading that you need, you should give around 2 to 4 months of time. In that time, you solve all the explanation of PMRCS, you check all the question of PMRCS question bank. After that, the first revision should be for within 1 month. And in the last month, you should solve the recalls, last 3 to 5 years recalls, plus all the FAUJIA. And if you want, you can give another revision and you can check out all the mistakes that you have done. So, is coaching mandatory? I have passed my MRCS Part A without any coaching, and without coaching, it is very much doable. But if you are an intern doctor, you don't have much clinical experience, or you are a very busy doctor, you don't have much time to study, in that case, you can take help of coaching. But always go for coachings that improves your basics. That is very important. So that's all for now. If you have any questions regarding preparation for MRCS Part A, you can ask me on comment. I will try to answer those. So thank you all. Take care.